Hi guys, welcome to our channel. Today we're going to talk about stone removal. So there are a couple of different ways that we can remove stones from the urinary tract. One of them is conventional cystotomy, and this is what's been done for many years. And the way it works is stones that can't be dissolved, which are typically like calcium oxalate, for instance, which is fairly common in older male small breed dogs. They can't be dissolved. They have to be mechanically removed. And so one way to mechanically remove them is by making an incision in the bladder, exposing the bladder, and then individually removing these stones. The advantage of that procedure is that it can be done by primary care veterinarians, and you don't have to necessarily see a specialist for that. The disadvantages of that approach is that, one, when you make the incision in the bladder, that the bladder is very vascular, has a very rich blood supply, and so it tends to bleed a lot. And that bleeding can obscure some stones and make it harder for them to be removed. With that, you can leave some stones behind. In fact, there have been studies done, even when these surgeries are done by board-certified surgeons, where 20% of the time they leave stones behind. So in essence, you decrease the burden of stones, but you don't solve the problem. And it's a lot easier for stones, especially small stones, to build up on each other versus starting from scratch. So ideally, you want to remove all of them. The other aspect of this is that when you make the incision in the bladder, besides the bleeding that occurs, that is also associated with a lot of urinary discomfort. So some dogs will have urinary symptoms, urgency to urinate, blood in the urine, sometimes for over 2 weeks after this procedure. And then the other thing is, as you're suturing the bladder, the sutures that are used, sometimes they can go into the bladder lumen per se, or like inside the bladder cavity, and as these sutures dissolve, they dislodge from the bladder wall, and they can actually serve as a nidus or as a place for a little mineral to deposit and form new stones. And there have been studies looking at dogs that have had recurrent stone removals, and they were able to find suture material in about 7% of dogs with recurrent stones and 4% of cats with recurrent stones. So the procedure itself may also lead to more stone formation. And the bigger your incision in the bladder, the more suture you use and the more likely that is to occur. Some of the other things, and this is fairly uncommon, but leaving, like I had a patient once that had a piece of gauze that was left in the bladder. The other really big thing is you want to avoid cutting into a bladder that has a urinary tract infection. I also saw a patient in the past that had a resistant urinary tract infection that after surgery, the dog presented with a mass in the abdomen. That mass was actually an abscess caused by a really resistant bacteria. And this is, your conventional way of removing stones. Fortunately, nowadays, we have better, more effective ways that are less invasive that can also be done. And so another method of removing these stones is by going in with a camera up the urethra into the bladder, and with that camera you're actually able to visualize everything, and we can actually use a laser to break up these stones into small pieces and then pass them through the urethra. So the lasering itself is a fairly quick procedure, and if you or I had this procedure done, the physicians would laser these stones, would break them apart, and then you would urinate the fragments out, because the way we stand, the exit of the bladder is gravity dependent, so we can just pee them out. But in dogs, or cats for that matter, because they're in a horizontal position, the stones stay in the bottom portion of the bladder, and so in order for them to be peed out, it doesn't really work, so you have to remove all the little fragments. And that sometimes can take hours. The smaller the urethra diameter, the more stone burden you have, the more fragments you have, and then the more time you spend removing these fragments. So that is what we had for minimally invasive ways of removing. And these dogs did a lot better than cystotomies. You were a lot more able to remove all the fragments, but with the in and out of the scope, if you're going in and out hundreds of times, you can get a little bit of edema in the urethra and discomfort urinating. Nothing like your cystotomies, but you still get some discomfort. And then a newer technique, which is a technique that we use for the majority of our cases now, combines the best of both worlds. It's called a PCCL, Percutaneous cystolithotomy. So you make a small incision in the abdomen so you can visualize the bladder, and then you enter with the camera, with the scope, directly into the bladder. So you literally are making an incision into the bladder about 6 millimeters wide. So it's really just the width of getting the scope in there. So the advantage of that is you bypass the urethra, so you don't have all the in and out. And with the camera, you're visualizing everything, so your chances of leaving stones behind are much, much lower. In fact, the initial study that used this technique had a 4% chance of leaving stones behind, and that really equal to a dog that had a single stone that when they removed it, stone fractured, and they just didn't go back to check. That was the only dog. So theoretically, if you're spending time in visualizing, there's no reason that you'd leave stones behind with that technique. And we use two different cameras, one to look in the bladder, which is a rigid scope, and then another camera, which is a flexible scope, to go down the urethra to make sure that as you're removing, even in patients that didn't have urethral stones before the procedure, you want to make sure that as you're doing the procedure, no stones went into the urethra, and they sometimes can get lodged. And the fact that we also have the laser, if you have any stones in the urethra that are lodged that you can't flush them out, you can use the laser, break them apart, use baskets and remove them. And you can also use flushing techniques to remove all these fragments out at a much quicker rate, because you are not bound by the urethral diameter, so you can remove them much quicker. And because you have a much smaller incision in the bladder, you still need to suture, but it's basically one suture, so you have a lot lower chance of getting a nidus from suture material or new stone formation from suture material. And because the incision in the bladder is so small, like, one, most of these dogs, they go home same day. And then two, most of these dogs, or cats for that matter, have no urinary signs after the procedure. And so this is a much less invasive technique, much more effective, that you can remove all the stones. Also, you have a much lower chance of stone recurrence because of the suture material. We have people coming from different states to do this procedure, because we know that this is the best way that exists in terms of stone removal. The disadvantage of this procedure is that you need a specialist doing it, and not just a specialist, but a specialist with the equipment to do it. You want to pick a facility that has a laser and basically has all the tools that can deal with any issues that arise. Because if you're doing this and you don't have the laser, and then you have a stone stuck in the urethra, you still got a major problem, because one of the last things we want to do is to cut into the urethra to remove a stone, because of the risk, high risk of, as you cut into the urethra, which is that tubular structure that connects the bladder to the outside world, as you suture, both the suture and the scar tissue from healing can actually make the urethra more narrow. We call that a urethral stricture. And then before you couldn't pee because you had a stone stuck in there. Now they can't pee because you have a narrowing from the procedure itself. American College of Veterinary Internal Medicine came out with a consensus basically recommending using minimally invasive techniques as opposed to cystotomies to remove bladder stones. In our hospital, our surgeons nowadays, they rarely do cystotomies, because the cost for them to do a cystotomy versus for myself to do a PCCL is about the same. And given that we're much more effective, less invasive, it makes no sense to do a cystotomy in these cases. been available now for a few years. We've been doing this for probably the past 8 years or so, but there's still lots of people that have no idea that this can be done or that this should be done. So hopefully you guys find that useful. Thank you. See you guys next time.